And so I got like really broad experience in a lot of different areas really fast. So I worked in 2 mental health clinics, one of which specialized in children, and the other was more adult. And I worked in a hospital emergency room, both in the psych emergency room and also in medical, where I did a lot of work with folks that had been either sexual assault or domestic violence. And I also worked in an agency called SPOP, which is a mental health agency. It stands for Service Program for Older People. And so it's a mental health agency serving older adults, and I worked in there in the agency administration. And then SPOP kind of slowly took over and became really my main job. And I eventually started working there sort of 3/4 time, and I had, eventually my title became Director of Special Projects. So that continued kind of the theme of diversity in what I was doing. So I supervised a couple of small clinical programs, but I also headed up the agency's quality improvement initiatives, which have become really an integral part of agency mental health in the last 10 years. And they also implemented an electronic medical record, and I was sort of in charge of that. Currently I work at, so I left there, and I now work at New York State Psychiatric Institute, which is affiliated both with Columbia Psychiatry and the State Office of Mental Health. So the Columbia side is more researchy, and the state side is more public health. So it's kind of like, okay, we've found all these things in research, how do we get them out into practice? And so I'm more on the public health side, and we have a group that has a particular health IT application called Psyches, which stands for Psychiatric Services and Clinical Knowledge Enhancement System. And it basically takes Medicaid claims data and sort of presents it in a way that is useful for clinical work and quality improvement. And then we do like a whole range of projects supported by that. And my main project is called the Quality Collaborative. So it's a group of hospitals that are doing the same quality improvement project, or not the same project, but doing their own projects on the same issue, so that they can kind of learn from each other and not everybody reinvent the wheel. So that really sort of drew in all of the clinical experience and the agency administration experience and my previous experience with the electronic medical record. So that's what I do now. And that path has kind of taken me a little bit away from any direct clinical work. So, which my next step, I think, is how to put that back into the mix. So.
I'm Thomas Johnson, and I graduated here in 1978. It's hard to think it was that long ago. But I'd come here, I think I was one of the first one-year residency graduates at that time. It was sort of a new, innovative program. I had been working with adolescents who had been remanded from family court prior to my coming into graduate social work. And they had an agency called Lincoln Hall in Westchester. And so I was there for several years before coming here. And actually, I'm currently working, unlike my neighbor here, I haven't moved around all that much. I'm currently working at the New York Harbor VA healthcare system, formerly known as the New York VA. We're comprised of the Brooklyn, Queens, and the Manhattan campuses of what's now one consolidated VA for New York. And I supervise staff in inpatient psychiatry and outpatient mental health, substance abuse, and PTSD. And I coordinate the graduate program for our interns, for second-year students coming to the VA. And it's always been a very popular place for students to come. One of the few placements that still offer a very nice stipend to most of the students who come to us. I took a 9-year break. After, the VA was my field placement, where I was in the psychiatric day hospital. Then I was able to be hired there, and then upward mobility kept pushing me to want to do more things, and it was sort of hit the roof. There was nowhere to go, no openings. So I was able to get a promotion at St. Luke's Russell Hospital, where I went to administration, and I coordinated the discharge planning programs for the Roosevelt Division, and I was there for about 9 years. Also got my hands into coordinating the student internship program there. And then after 9 years of that hectic environment of being in the, we call it the real world, the private sector, I decided to come back to the mothership, back to the VA, into another experience where I find myself now. But all through those years, I think after being in the field for 3 or 4 years, I went for analytical training and began to develop my skills at that level. So I was able to develop private practice, which I continue to this day, which I couldn't do if I was doing direct service all day long. I don't think I could possibly do it in the evening as well. So I thought that was a nice way of having a shift and being able to use myself in a variety of ways.
My name is Saranden Seip. I work for Fordham-Tremont Community Mental Health Center. It's part of St. Barnabas Hospital in the Bronx. I work in an outpatient mental health clinic for children ages 5 to 21. We do individual, groups, and family work. I worked for a couple of years in various mental health settings as a case manager in Arizona before I decided to move to New York and come to school here, and I graduated in 2010.
Great. So I'm going to ask you the first question. What brought you to your current agency, and what do you see are some of the benefits of working there?
Well, before I came to NYU, I was pretty certain I wanted to work with adults. And then my second year internship was under Chaim Mermerstein at Beth Israel. And her obsession really is Minuchin and structural family therapy. So she, had us videotape our sessions. She really had us focus on work with the family, some Bowen aspect of Minuchin. And I too saw how beneficial this was to working with children of all ages, but really just the involvement with the family if you want to see direct change quickly. And that's when I realized I really wanted to work with not only children, but families as well. So, and benefits of working where I am right now. Well, if anyone's been a case manager before, I don't have to do home visits anymore, which I do not miss, to be honest. And I have set hours, which is very nice, unless there's an emergency, which you can't just walk out. And I have an office, and it's a kind of like a set situation as opposed to a lot of the bouncing around, which we can find in a lot of social work settings, which can be beneficial, but happy to have that change.
Who else is next?
Well, my first job was at the VA where I was placed, and enjoyed working with veterans, working with adults and their families in the psychiatric treatment program we had at that time. It was a nice change from having worked with adolescents for like 6 or 7 years before, where I had to make many home visits. It taught me all the areas of New York City, climbing upstairs, learning when to get into neighborhoods and when to get out, because New York was not such a safe place in those days when you went into the outer parts of the inner city. But I covered all 5 boroughs, and even to this day, it's beneficial to know where a veteran comes from. Well, I may have worked with his son. Probably now, I'm working with the same patients that maybe I had worked with when they were adolescents and they had been sent away. And I found it a good place to learn because it is part of the NYU Medical Center, and so it's a training hospital. We're connected to NYU, to Bellevue, so we have residents running through the 3 buildings, and it exposes us to a lot of the current trends. The VA also was attractive because when I came back after being at Roosevelt, where everything was done by paper, VA was the first organization nationally to have an electronic computed medical chart. And really was just wonderful to get into that and learn that, and it really set the model for many of the other medical programs and, I guess, private settings that now use it as well.
So I think, like, kind of talked about what brought me to my current agency. So I'm going to focus more, I think, on what are some of the benefits of working there, if that's okay. And actually, I wanted to just mention also sort of benefits of agency work in general, because I think that when I started, I anticipated going into private practice or maybe balancing, kind of doing the, working part-time in an agency so that I would have some sort of stability and benefits, but then mostly, building up a private practice, or I shouldn't say mostly, but like significantly, as a significant portion. And I have, had, some private clients at different times, but originally I thought, oh, I could do that because I can sort of put up with like ups and downs in my income, and I was sort of like willing to do that to sort of be able to do what I wanted to be doing. But I started out doing clinical work in agencies, which I thought was, I think is really important to do to build your foundation of your skills and to have that supervision and to have that sort of collegial community rather than going directly, not that somebody might not start taking clients, but to not just sort of like go into your own office and hang your shingle and like that's what you do after social work school, but to just kind of have that community and the support, I think is really important. So then I got to a certain point where it was sort of like I had done that clinical work for a few years, and I kind of needed to be like advancing in my income, and it was sort of either kind of move up into agency administration or really get the private practice going. And I kind of realized that I thought I had the personality for private practice, but I didn't. And the reason was because I'm much more of a, like, I want to just do a good job and have somebody say, like, great job, you're getting promoted, as opposed to, like, having to go out there and market myself and hustle and network and have that, there's a certain confidence and a certain marketing savvy that you have to do that. And that wasn't really, and I didn't know that about, well, I knew that about myself, but didn't realize that that would be, like, a major issue in whether private practice would work for me. But in the end, I think I really liked this sort of the community of the agency, and I liked having people that would sort of recognize me and help me move forward as opposed to having to just do that kind of continual marketing of myself. So in terms of agency work in general, I mean, there is this sort of security and benefits. It's collegial, and it does work well in combination with private practice. In terms of my exact agency, I mean, I do love working in some place that's just very sort of well respected and is really at the center of learning about mental health, and there's constant opportunity to learn. There's grand rounds, and there are all different sort of seminars that they have on different things like law, psychiatry, and ethics, like whatever your thing is. So that's really great. Another thing that I've kind of learned is that the people that I work with is really, really important to me. The people are important, but working with good people is important to me. So, and I've been really, really lucky that I've worked with people that I respected and could learn from and liked and wanted to see every day. And that's true of my current job, and that's just a really, really important thing. And I've had jobs where it was kind of like in the interview, I was like, I'm not sure if I really click with this person, and those always turned out to be a bad idea. And sort of having that sort of really being with people that you like and respect is really important. And the other thing is I'm a single mom, so I had a son on my own, and so if that's in your plans, if having kids is in your plans, you can't even imagine how important logistics are in that when you have little kids. And so having a job that just works logistically is really important. Having a job that's not a really long commute, having a job where if you get a call from the school, you can go. Those kind of things are really important. So I think those are some of the issues that make my job a good place.
Can I just elaborate on what Kate said in terms of enlarging upon a bit the contrast between agency-based practice and private practice? I think you were implicitly saying it, but from my own experience, private practice can be a very lonely experience because you spend many hours alone with your client, and so you have to develop affiliations, having a part-time or full-time position with an agency, get involved in the educational endeavors to keep yourself fresh and stimulated, and both are great, but they also have the deficits.
Yeah.
Right?
In addition, making sure that you're covering your own, insurance, you're
Yes.
covering your own, paying for the facility where you're going to conduct therapy, and so taking a lot more on your own, for obvious reasons.
So I can answer the question. So what brought me to my current agency? So while I was in grad school, I heard a lot about the Jewish Board being one of the great agencies to go to and an amazing place to be. So I was looking for jobs and doing the work I actually wanted to do, and they happened to post a listing for the agency I'm currently working, or the program I'm currently working in, and it sounded really interesting to me, working with adolescents, and I really wanted to work with adolescents, and I wanted to work with adolescents who were more present and more required to actually be where they had to be, as opposed to having to track people down to like outpatient, having to make lots of phone calls. Residential, the kids are there, so they're an active, captive audience, which I thought at the time this would be great. So that's what brought me in the first place, and I think a lot of what I was hoping for really has happened. The Jewish Board as a whole, there's a lot of emphasis on training and continuing education that they pay for, which is really nice. I've been to trainings at the main office downtown. They've also had a lot of trainings just for our clinical department, which has been really great. And it's stuff that's very, like evidence-based practice training that can really be directly applied, along with supervision on how to implement those trainings. So it's really helped me grow a lot within only about 2.5 years of doing work. I feel like I've learned a lot more than only 2.5 years of work. Some general benefits about the program I'm in, I definitely agree having a good network of people to work with is really important. We work in a team-based approach, so there are the therapists, but there's also like psychiatric people, staff who work directly with the kids, people who run the apartment program, so discharge coordinators. So a lot of different people with a lot of different perspectives, which is really nice when someone has a strength that I don't have. I can go to them and say, hey, will you help me with this? And I'll do it all on my own. Or, say I'm having a really challenging day with a kid, I know that this person can support me and getting those to me more, so I can pull them in and it's not all by myself. So I think having that environment people I can connect to and use to help my day be a little bit easier is a really big benefit.
I'm going to ask one more question, and then I'm going to ask you guys if you have any questions. So get ready. So what are some of the challenges you faced at the beginning of your career, and how did you overcome them? Anyone want to go first?
I think the biggest challenges was finding a job I actually wanted to do. My first job out of grad school was actually at my second-year internship. I wasn't expecting it, and then after I left there, my supervisor had called me and said, oh, we have a position opening. And I thought at the time it was going to be very similar to what I was actually doing as an intern, and I said, okay, this will be enough, this will be fine. And the position ended up changing, and there's a lot of things about that I really didn't like, so I ended up leaving there. Went to another job for about 2 weeks and got even more discouraged and more frustrated, and then just had to say, okay, I'm going to wait and find a job that actually is going to be doing what I want to be doing, and I was lucky to find that not too long after. But it was a lot of having to, I guess, like a mixture of patience and mixture of like prioritizing, is it more important to have a job versus be happy with what I'm doing? And I think figuring all that out was kind of a challenge, and having to be honest with myself. And in doing that, I think it all kind of worked out. So.
I would say one of the challenges in my first job after graduating from NYU was trying to find my own sense of professional self in a very large administrative, bureaucratic organization, and everything was very interdisciplinary. It took me about a year or two to really get a handle on what my role was, what it could be, the freedom that I actually had to create my own style in working with patients and families and colleagues and the powers above me. And I think that once I got that more or less grounded, my confidence grew and I became more autonomous. Because the supervision that we were providing in those days was not really clinical supervision, it was more or less administrative supervision. And if you wanted clinical, well, then you were seeking that out on your own, which I think is still going on today, even more so now for students, graduates who are trying to get their LCSW. We didn't have that problem in my day. We got it just by the process of time. But I think that having had those experiences just helped get my struggle was finding who I was, letting myself as a professional to find my role more clearly for myself.
It's funny, so I think my favorite part of my career was the very early part. So I think it's true that we didn't have the LCSW challenge at that time. So, and it's really kind of a catch-22, I think now. So I imagine that's probably the biggest hurdle. I mean, I would say, because I was not working at one job that had benefits, so I was carrying my own health insurance, which again was not, I mean, now it's much more prohibitive than it was at that time. But I actually think that it was and this might be different for different people. I think in the beginning there were all these things I was interested in, and there were like so many things I had sort of done a little of and wanted to sort of do more of, and you know, I was kind of looking at new grads, and there were a lot of new grad jobs, and it was actually more a little farther on where I really sort of had to hone in on what I wanted to do, and sort of figure out how to make that match between my own sort of peculiar set of skills and, you know, what was out there. That was actually a little trickier for me, I think. But I guess if you have a much more specific idea of what you want to do, then that might actually happen earlier in your career. But I think the more wide open you are, I think the easier it is in the beginning to just get that experience.
But, you know, clinically speaking, as they were saying, your first, well, in my experience and the experience of a lot of my friends, your first job right out of graduate school oftentimes will not be clinical, and I'm saying that only based on the assumption that a lot of you want to do clinical work, which is why you chose NYU. It's kind of like, you know, the age-old thing where, oh, you don't have enough clinical work to be doing this clinical job, but you know, all your education is clinical. So that's frustrating, and that was frustrating for me when I immediately graduated. I went back to a job, which is something I had done before, and, you know, again, a great learning experience, and it pushed me a little bit harder to find a clinical job. But don't be afraid to, you know, rely on the people that you went to school with, to use your resources. I think sometimes we shy away from seeing where other people are going. Have you heard about anything? You know, use the NYU website, because clinical jobs, you have to get into that interview and show them you actually know what you're talking about. The other thing that was challenging for me just starting off is, I mean, I have 60 clients, and you already know how hard social workers work. We all work very hard, but it's a lot of work, and you have to be very, very diligent when it comes to completing your paperwork and time management. And I know that we've all heard this ad nauseum, but it's very important because it will pile up.
Yeah, I would say, I think so I had actually had some sort of additional clinical training prior to social work school. I had been training in psychodrama, and then right after I graduated, actually one of my professors here mentioned, oh, there's an open house for this one-year psychoanalytic program at postgraduate, and I went to that and ended up doing that one-year program, so that also gave me more clinical experience. And I also, one of the several reasons why I did part-time work was that I was, my second year internship was at a fee-for-service clinic, and so I really wanted to, I was like 6 to 8 months into treatment with my clients, and I thought it would be like the best educationally for me to just continue on into that middle stage of treatment with them. So I was sort of in a very clinical place by doing that sort of I think that was sort of the strategy for getting past that initial, like, you just graduated, you don't have clinical experience, because I was sort of in all those things.
Yeah, I think to touch on that, I think experience from your past prior to social work school, maybe even if you emphasize that, it can really get your foot in the door. I think part of what allowed me to get the job I have now, when I was in college, I did an internship at a group home, and then I ended up working at the group home afterwards, so I had residential care experience. And I think that because I was working in a residential setting, that kind of made me look like it's more eligible for the job. So don't discount the experience that you've had outside this context. I mean, especially if it directly applies to what you want to be doing, because that can really, get you ahead of someone maybe hasn't had that same kind of experience. And I think actually, a few other people I've worked with have also worked in residential settings more as counselors, like on the direct care role, and I think that's what's allowed them to get there.
So do you guys have a question you want to ask?
Yes.
Yes. Go for it.
And for the Tom, we were talking about kind of like the experience of the loneliness of clinical practice. And I'm a learning specialist, and I have a consulting practice, so I know what that's about, and it's really important to develop a network. But in my first year placement, I'm a second year student now, so in my first year placement, I was in a community mental health center, and I felt that it was the most isolating place I had ever experienced. I mean, I guess due to the nature of changes in billing and the need to keep a center open. I mean, there were so many practitioners there, but I rarely saw anything but a closed door. I came in, I went to my office, I did my work, I saw my own clients, and if I was fortunate to, and there were it was like a weekly staff meeting, but usually that was not a very uplifting kind of experience. So I'm just wondering, like, in your own agency experiences, how were you able to, or what is it like? Is my experience so different from what I might expect next May?
Yeah, at my agency, it's very team oriented. It has to be. So I think by default that kind of forces it to not be so isolating. That being said, it did take me about 1.5 years to really seek out other people and connect with them. I think I'm also kind of a more shy person by nature, so that was part of it. But also, I think for me, I was able to say, okay, these are people I actually do connect with them, and reach out to them, just talking about my concerns. Because I think I went in thinking I had to talk to the therapist, they have the same job as me, so I'm going to talk to them. And I realized, well, actually, no, the discharge coordinators are more welcoming and more comfortable. I'm going to go to them and form a connection with them, so that helped. Then I started, saying, okay, I'm going to talk to some of the individual counselors in the apartment. People I like, I'll talk to them, and I make a connection with them. Then I think about maybe 1 year ago, probably a lot of things with proximity, but there's a new social worker moved into the office across the hall from mine, so I became friends with her, which was really helpful. And then, there was someone who does a CPI, so the quality improvement at our agency. She seemed nice. I started talking to her, and now we're friends. So I think for me, it was a matter of having to push beyond my shyness a little bit and reach out and make those connections on my own, and then also open myself to the people in my treatment team, and that allowed for more of a connection within that group. Because the way it works in my program, there's kids who live called apartments. So there's about 11, 12 kids in an apartment. There's a team leader who runs the apartment, about 8 or 9 staff, a psychiatrist, and a primary therapist. So the people since I have most of my kids in one apartment, I see them all the time. I deal with them all the time. And I've had to push myself to be open to reaching out to them beyond just meetings, and that's helped me feel more comfortable and not so isolated in that setting.
I think even in a large agency where I am now, when I first started in hospital social work, mental health, or strictly medical, the reimbursement formula was very different. Mm-hmm. Hospitals were paid for keeping the beds filled. Mm-hmm. Now we're being paid for keeping the beds empty by having shorter admissions and focusing everything on outpatient care. So the social workers are really with having to get patients out faster and faster and being much more creative. And I think in that sense they get isolated also. So it's important to bring them together. That's why I offer some group clinical supervision, and having that group activity, it's the only chance they may get. they're working on different floors. They may not have offices next to each other, but there could be 10 floors that separate them, and they won't see each other all day, all week long. So having that kind of relationship, I think, around some clinical issue that really is stimulating to them, not only just to give them credit toward their LCSW, but also keeps them vibrant and connected with each other.
Sounds like a good pops project.
What?
Good pops project.
See, you bring up an interesting question, which is, you know, how do you determine that the culture of an agency is going to be appropriate for you? Do you have any strategies for that, like even in the interview phase or anything like that? How do you figure that out?
I mean, I don't necessarily have a strategy, but what you were talking about at the beginning is really make sure that you gotta work, but you want to make sure that the vibe you're getting from the people that are interviewing you and what they're telling you is going to be your day-to-day and what the office feels like to you. Feels good. I knew when I went in for this interview that I hit it off, so to speak, with these people, and it was comfortable, and as long as you do your work, they're going to be there to support whatever you do. I've never actually worked in an agency setting where, maybe the boss didn't necessarily get along with everybody, but most people were pretty interactive, and I personally find that one of the most helpful aspects of my job, because if I couldn't rely on my coworkers when I'm having a really stressful day or something really, when there's been an emergency situation in your office, if you can't go talk to those people, it will be very isolating and more draining.
Yeah, I think that there's, so the community mental health system is under huge pressure right now, and it's really gotten more so over, the last few years. They've, done this, they call it clinic restructuring, where they've changed the way that reimbursement happens, which in some ways is way more rational than it was before, which is good, but it's also just lower in general than it was before, which is not good. So it's put everything under much more of a strain. And I've seen agencies like, Spot, when I started, it was sort of like a point of pride that, they had this 2-hour staff meeting every Monday where they would do clinical case conferences, and they would have people come in and lead special trainings, and they literally had to stop having that every week because it was too much of a drain on productivity. And so there's all that kind of thing going on. But the other thing that I see in my project, we work with a large group of hospitals, and there are just, there are some of them that are like, we can't do this, we're just under pressure trying to stay alive. And then there are other ones that are under equal amounts of pressure, and yet they still manage to make a priority of improvement and training and moving forward. So in terms of how you would sort of find that out, I think group supervision is one of the major things, because that not only gives you the supervision, but it gives you the community. So if someplace makes a priority of group supervision, and I think generally, I think people mostly ask about supervision now anyway because of the LCSW credentialing, but I would even say specifically group supervision in addition to individual. If you're getting individual and group, then that's already giving you like the foundation, and I guess you could even, partly it's just a chemistry thing, but maybe you could, ask about different, I think you could even just ask about community building among staff, and sort of see, partly I think it's a vibe.
One of the ways that you can get a feel for an agency is just the hiring process. When I went for my interview at Roosevelt Hospital, I was one of, they did a group interview. I've always been involved in groups, it seems. So the 10 finalists of whoever had sent in a resume for this position, we all met in the room with the director and the assistant director, and then they narrowed us down to 5. And I couldn't believe I was still in the running, because I didn't even take it seriously. I said, gee, they don't really want me. The only supervision I had done was student supervision from after my 3rd year out. So then they narrowed us down to 3, and then we had to be interviewed by the social work group that we were going to supervise. So, and there was even an internal person applying for the job, and he had to be interviewed by the group as well. And I just lived through that whole process. It was called participatory governance in those days. The staff really participated in making decisions for the department. Couldn't afford to do that these days because the world has changed so much. But I just felt, well, I really want to come here. I really think this is where I want to be. They really listened to us. So, and yet it was like we were making a marriage. I knew them, they knew me, we knew what we were getting into. And I think that was very helpful. I don't know if it even happens anymore, but that was a wonderful process.
Yeah, it's funny, you know, when you're doing clinical work, they always say like the client will sort of reveal their patterns in the first session, and an organization will reveal its patterns in the first interview also. So, so you can learn a lot just from both the unspoken and unspoken things that go on.
I have two questions. They're not really related, so I'll start with one that first kind of goes off of this in terms of the culture of the agency. So for someone like me who's interested in mental health clinical work with children, it seems like you two kind of fall into that category, but obviously two very different environments. So if you two could just kind of describe to me, because I've definitely applied to both types of agencies. So if you could just describe kind of like the differences.
Kind of like what our day-to-day is.
I guess, or just, you know, I guess I've just heard that hospital settings are much more fast-paced, and I don't know. I guess, yeah, take it away.
Sure. I mean, I get part of my second internship was doing more outpatient kind of work, so I can do it as a comparison point. I mean, I haven't really worked in a clinic, but it's definitely being in residential 24 hours. It's much more intense and much more, rapid. Like I feel like, as earlier, I feel like I've been there for a lot longer than I have been because it's so much happening all the time. It's also, I mean, it's a smaller caseload. Right now, I have 10 cases, which is a lot for there, but it's so much more intensive. Because, I mean, you don't see the kids for an hour and they leave. You see the kids technically throughout the whole time that you're there. So you meet with them once a week, but then you see them all the time when you go over to talk to the kids in the apartment. You have conversations every day with them when you see them and check in with them. You have to go interact with them when there is a crisis going on. So you have to go do crisis management. You also have to work with the families, so you're constantly involved with the families because the kids are living there. It's much more, I imagine, much more active involvement because if there's an issue, you have to call the family and say, this is what happened. Let's talk about how you're going to feel about this issue, how you're going to talk to your child about this issue, and how we're going to deal with it here. So it's like a mixture of that kind of stuff. I think it's also more intimate with the children. I mean, I feel like I'm constantly being sensitive to what my boundaries are with them because I don't want to give too much of myself. At the same time, I feel like in order to do the job well and make the connections, you almost have to give a bit more of yourself than you might in a setting where you have maybe 45 minutes, an hour a week interaction. Because it's more like seeing people on a daily basis and making that having to make that connection with those kids so they can trust you, so they can come to you when they have a problem, and they'll talk to you if there's a crisis going on. Also, I'm not sure it's as special in my age, but I think too, just you have to do that to build the trust with so many of the kids we work with have such a trauma background, and also a large history of being bounced around from place to place to place. And so in that sense, you have to learn how to deal with kids who've been through a lot of really horrible stuff and might have trust issues, might have the opposite of trust issues, might have terrible boundaries. I think it's a higher level of intensity than you might see in a more traditional outpatient kind of setting.
That's correct. That's right. Because the kids that I'm working with, well, first of all, as she said, all families have to be involved.
Yeah.
If there's an issue, the family's going to be involved. And of course, if there's anything high risk, we will make sure that the family is involved where I am as well. But you're always going to have family members or parents that will just absolutely not come in for therapy with their kids. There's always going to be something that comes up, and I'm not saying all the parents are like that. A lot of them are super active and come in every week to participate in family therapy. But sometimes you're going to be very isolated to just working with that client. That said, I see them for 30 minutes to an hour, depending on what type of therapy they're in. 30 minutes for individual to 45, and then an hour for family work or groups. So it's shorter time-wise than what she's doing. Any sort of crisis scenarios that do come up, we immediately will involve EMS or call 911 because we're the mental health branch of the hospital. So it's not like working in an ER. One of my internships, I had to do some TV work in the ER, and that's very fast-paced. You know, you're running around, you're trying. It's stressful, but it's not like that. You have a schedule. People come in, or are supposed to, at their times. And if you need assistance, you're going to ask for assistance because you're not equipped to handle all those things. So even though there are crisis situations, you're not going to be doing as much crisis work as you should be doing.
And then my second question. So you all had mentioned having experience, clinical experience, before getting a job, and how when you first graduate, you don't necessarily qualify for those very clinical positions. Would you recommend or suggest, do you think that case management is a good stepping stone to that, towards that direction, or not necessarily? It puts you in a different, okay.
I think so. I mean, I'm sorry.
I think there are more agencies. Well, we're doing a great deal of that now. There are homeless population with veterans. It's a tremendous initiative that Washington has given us, and we've hired so many. They're all LMSWs. They have to come in on board with that. And it's going to be hard for them to get the LCSW, but primarily what they're doing is casework. But it's often very clinical because our population usually carry a psychiatric diagnosis as well. But it's a wonderful stepping stone for them to get into our organization, but also into their own practice, their own profession.
As far as familiarizing yourself with the population, if you're going to be working with kids who need case management involvement, you're going to be working with kids who are going to need clinical work later on down the road. So it's a way to get familiar with the family, get familiar with the kids, and just from like a practical sense, it's really good to know how the agencies work. A lot of the kids that I work with have case management involvement, case planning agencies, and constantly involved. And I didn't do a lot of that, but a little bit I did do. It makes it a lot easier to know how to work the system, because it's all about also knowing how to negotiate systems and work within them and work against them sometimes, and how to get them to do what you need them to do. So if you have that inside path, you're just for yourself, you're going to have a step ahead, much more knowledgeable.
I would also say, I think one of the things that served that for me was my work in the emergency room. So actually somebody in my class her placement was on a mobile crisis unit at a city hospital, and they were looking for people to work per diem nights and weekends, and I just thought that sounded really cool. But also someone who was another student who had worked in a similar setting said, if you're doing outpatient work, it's really good to see people in a very acute state, because you know what to look for, and what you recognize the emergencies, and you recognize like where on the continuum people are, and that was really true. And so I ended up interviewing. So actually, while I was a student, I interviewed and I started working, and then they actually didn't have a spot in the psych ER at that time, so it was kind of like hired but without a spot. So then I found a spot in medical, and in medical they have a volunteer program called, I assume they still have it, although I don't totally know. It was run out of Mount Sinai, called the SAVI program, Sexual Assault and Violence Intervention, and they had volunteers that came from the SAVI program, but I'm pretty sure that they actually either sent us to it, or they kind of gave us a brief version of it. So that kind of thing, like doing that kind of volunteer work, either working sort of weekend type things that sort of you could do when you're a student, and would be a way, and also those type of volunteer programs would also be a really good way to just sort of get that, if that's your interest.
But yeah, being a CM, and luckily there are a lot of CM jobs available, which is good. But yeah, I think a lot of what I've learned in the social work field was based on the 3 different CM jobs I've had. But you know, you can hear somebody talk about their living situation, you can hear somebody talk about their school situation, you can hear somebody talk about their home life. But once you're in it, it's a lot more clear what's going on. And I think it's really important to have that knowledge basis so that you can work better with your clients in the future.
Any question?
Question. So this is going to be, I haven't started the MSW program yet. I started in the fall, but it's going to be a second career for me. And I have no psychology background, I have no training in that. So these volunteer programs that you're talking about, the Savvy program, do you need a certain type of background to give your time to them, or do you know of any volunteer programs that?
They could train
Yeah,
training.
That's
Yeah.
volunteer.
Okay. So any other suggestions?
Well, when I was in college, I volunteered on the suicide crisis lines for about 5 or 6 years, and that was a great training for crisis management. And I know, and I was in California, but I know New York has a suicide crisis hotline. I think that's amazing training for doing like the most intense kind of stuff you can do. I mean, it really allows you to see how much you can tolerate, learn how to do self-care, learn how to work with really, like intense situations, or how to deal with like really vulnerable people. And when I was volunteering, I think there was like maybe one person who was working as a therapist and a bunch of college students who might have been studying psychology, but it was a lot of just people in the community who wanted to help out. So I think that's a really great learning for, foundation.
Yeah, I worked on a hotline as well. The one I worked on doesn't exist, but suicide hotline. Also, I think the Mental Health Association of New York has a hotline, and what they do now. I mean, one thing, there are a lot of hotlines that aren't that clinical, so you do want to try to find a hotline where you're doing something a little more clinical and not like, the closest food pantry is, not that that's not important, but that's not going to give you that clinical experience. The Mental Health Association it's called the SPOA, Single Point of Access to certain mental health services within New York State, or city, I guess, it's the city, it's the SPOA for New York City. So, and they have volunteers, and so you're assessing on the phone what's the service that the person needs, and you're assessing if they need a global crisis, or, would they meet the criteria for an ACT team, or do they just need somebody to talk to them for a little while? So that could also be a really good sort of volunteer possibility.
And there's a domestic violence advocacy program at Beth Israel. That's pretty good. Also, just get on some listservs for Planned Parenthood. Another good one is the Women's Therapy Center Institute. I think that's what it's called. They have free training sometimes, or it's donation only, or you can go and learn about some things and build your knowledge base. But also keep in mind that once you leave this program, you will have experience. You will have 2 years of really awesome experience that you can put on your resume. And so keep that in mind. The internships, at least for me, were incredible. So.
Yeah, my internships were
If you got accepted here, you're
right.
on your way.
Yeah.
So you don't need to worry about that. But for the summer, you may want to do some of the things that were suggested. Also the senior centers. Their services are being cut back in New York, and they utilize a lot of volunteers in various ways. Home visits, they're very isolated, companionship, volunteering. So you may want to look into something like that as well.
Another thing that I would say is to just make sure that you get plenty of work in your internships, because I was really lucky that my supervisors weren't shy about giving me work, and even my first one was more sort of assessment, but my supervisor said, like, I think you need a couple of ongoing patients for your time here, so you should, or clients, so you're going to do therapy with like these 2 people in addition to the assessment that was the main part of my job. And she gave me, I think my assessment caseload was smaller. Well, I was 3 days, and the full-time people were 5 days, but I had like 60% of a caseload, right? And then I've worked at other places, not where I was a student, but where they're like, well, let's just start her out with like 2 cases, and it's not. I'm so glad that nobody did that to me, because I don't think that that's doing a favor, because when you go into a session, you need to sort of know what the range is, right? Like if you go into a session and you're feeling like insecure and like the person is embodying with you, well, if that's your only patient, how do you know if that's what you bring to the session, or if that's your countertransference, right? But if you have like 8 patients and you only feel like that with 2 of them, then you begin to understand what you're doing in a different way. So, I mean, I would say even other than going around all over to kind of make sure that you get as much as you can
And speak up quickly if you feel like you're not, because I think what a lot of people do when they started is something wasn't right, but they didn't want to kind of bother anybody. So then it's halfway through the semester, or you're going into your second semester, and now it's going to be really difficult to switch you or to have that conversation with their supervisor about giving you more work or figuring out how you're actually supposed to be getting out of this, what you're supposed to be getting out of it. But that said, there's also the other side of it. I know that in my internships I was very eager, so I took on a lot more work than other people, and I hit a wall. And I needed to have a conversation with somebody that, oh wow, I have a lot more work than other people, I have done it to myself. But make sure that you speak up about that too, there's a balance. So.
Usually in your first year, I assume it's still true, you don't have much choice in your field placement. So you may feel very stuck where you are, but it's very important, as was said, to speak up. I've interviewed many interns for our internship program coming to the second year, and I've heard horror stories about the lack of clinical supervision they were getting. The supervisors that were overwhelmed with work, and they had very little time for their intern. So you want to be sure that you can protect that time and not let it get lost. They may use you as an employee, and there is a difference between what an employee does and what a student does. So you're protected in that way, but you also want to keep appropriately busy.
I would like to just add something to that actually. As a having gone through my first year internship in his placement that most people said was a second year placement, but think of yourself as your own climate advocate for yourself. Because of
Good advice. Yeah.
Yes.
Do you have a question? You look a little crazy.
Me?
Yeah.
Let's see. Oh yeah, I don't know if you guys can talk about this, but what are interviews like at your agencies for people who are coming on board?
Well, for my agency, I had 2 interviews. I think other people have many more than that, but the first one was actually, it was kind of daunting. It was 3 people, which I wasn't expecting, and it was all people who were the clinical top administrative level. So that was kind of intense. And the second interview was actually going into one of the apartments and sitting with the kids. They have a meeting twice a day just to check in about how their day was. So I sat in the meeting and participated in the meeting, and then I met with the person who ran that apartment. So I think in that sense, the interview was trying to really get me to be a part of different parts of the program. I know when they interview people now, they try to get different people throughout the program and meet with the person and get different perspectives, different impressions about them. So that's my experience.
It's good to have an interview where you are being interviewed with the person that has the power to hire you, but also maybe they'll bring in one of the line staff in also who's doing the work. So again, it's a little more anticipatory. They're giving you the real reality of what's going on, where the supervisor may not be in touch with it. So it's a nice balance for you to ask questions and for them to make a more informed decision about you, and the same for you about them.
Yeah, I would say that as when you're looking for someone to hire, especially our job's a little quirky, so you really want to figure out if the person, do they just need a job or do they actually want this job, and you want to pick the right job, and you do want a job, right? But you want to be in the right job, and the employer wants the person that's going to be in the right job because they don't want the person to be unhappy and leave in a month, or so everybody wants it to be a good fit. And so a lot of what we try to do is just understand not only could the person do the job, but does the person want to do the job? Like for instance, ours has no direct service, so you need to be kind of clear if that's what you want to do. And I think, and we give people an opportunity to ask questions, and you want to ask questions that are sort of respectful, but you also want to make sure that you get the information that you need to know if this is a job that you want. And I know when I'm on the other side of the table, I totally appreciate somebody asking questions that are going to get them the clarity that they need.
When we have an opening, we generally try to hire from our internship pool, and we call that succession planning. And so it's important to us that our candidate knows the environment, the culture, the population, and that we know the candidate very well. And it makes hiring much more secure. So it's more of a win-win for both.
Yeah, actually, just to say the physical, so our process starts with a phone screening. So once they screen your resume, the next thing will be a phone screening just to make sure that you know what the job is, get a sense of you. Then people come in for a 1 hour, and the first half is, and because we're kind of a team, so we have like a group of younger, more junior staff that kind of works with a group of project directors. So the like 3 or 4 project directors will interview together, and then all of the people that would be at your equivalent level, which is like 4 or 5 people, come in and kind of ask you questions, but also can answer your questions about the day-to-day. And so I think it's a little, it can be a little, intimidating maybe to be interviewed by 4 people at the same time, but it's actually, I think it's actually just a pretty efficient way so that everybody doesn't have to ask you the same questions over and over, and they're social workers, so they're not like intimidating. But so it's something to be prepared for, but it's usually, I think, it's really more to your benefit because you don't have to keep on like telling your story over and over, and you get to meet everybody.
And with large agencies, sometimes it's going to go past even the assistant director and the director. So with where I am now, I submitted my resume, phone screening, just like that, and then I had about a 45-minute interview with the assistant director and the director. And keep in mind, in that interview, I don't know if this is common, but they asked me specific diagnostic questions. So I had to be aware of symptomatology, I had to be aware of high-risk symptoms. They gave me, brief cases, and I had to kind of talk about what should be done in that situation. And then after that, once they approved me, then I went to HR and had to meet with that woman. And I know there have been situations where maybe one of those people, felt that someone was a good fit, but maybe HR didn't, so then it wouldn't go through. And then just to keep in mind, with a lot of places after that, then you have to go and have a medical screening. Then you're going to have drug testing with a nurse sitting in with you. Then after all these things are completed, so sometimes it can be a long process. So, but just speaking about the mental health portion, if you guys are going into fields where you're going to be diagnosing and working and things like that, one of the most helpful classes I took while I was here, I printed out my own schedule, was Human Behavior in the Social Environment 3. Yes. Who is I cannot remember her name for that. I don't know if she's still here. Does anyone know the doctor that teaches that?
Well, there are quite a few. Carol Tasson, Berger.
Yeah, Berger.
And
Berger is really, really knowledgeable and really, really very good at explaining things in a very clear way. And he's a really smart guy.
But I thought it was an important class.
Yeah.
Yeah,
especially
it's
for
like
working.
up at the top of the list.
Yeah. And now it's actually when I was there, the DSM-4 had just come out, and so all the professors were like, well, this is really DSM-3, but you can kind of translate, and now it's like a lot of the same thing with 5.
So we've hit our 2:00 limit, but there's nothing in this room afterwards, so we can keep going if you'd like, but if anyone has things they have to do,
I'm
then.
not totally fine, but I would say thank you so much.
Good luck to you.